is demand ischemia at rest. You're not even using your leg, but your PAD is so severe that any drop in pressure to your legs will elicit pain in your toes, particularly your toes, right? That's called rest pain. Beyond rest pain, you have tissue loss. Tissue loss is tissue gangrene or wounds, right? And so that's the end stage of PAD. So patients that have demand ischemia, they have severe PAD, they could have rest pain with a low hemoglobin on the circuit. They could have rest pain in their upper extremities. You know, most of the end-stage renal patients will have PAD essentially below the level of the elbow.
Okay.
So you'll see some steel symptoms there.
So, wow. I mean, I got to say that we're 20 minutes in, and I've been around this my whole life. So steel syndrome, steel phenomenon, no stranger to me. Cramping during dialysis, no stranger to me. But I got to be honest that I've only really thought about this PAD when I see those patients with ulcerations and wounds that are not healing. So Veronica, I'm curious, since you're out there educating the staff that are on different care settings, caring for patients in nursing homes and dialysis centers, I'm not sure where else you see referrals from. What are they coming in for? Like, how do you go out and educate and say, if this is happening, this is happening, this is happening, they should come in for, is it evaluation? What's that?
Yeah, it would be an evaluation. So having any pain or like the doctor said, any having cramps while resting, not even, doing any movements. I mean, there's all these signs to it. And yes, we will have them come in. They'll have an ultrasound before, and then they'll have a consult with the doctor and go from there and see what the doctor sees in those ultrasounds and go from there.
Do you train on like causes and prevention of PAD, or is that something that should be happening on the primary level? Where does that fall into place?
I would say both. I think anytime we can get any of this information out, it's great. It's heartbreaking when you hear the stories of, grandma or grandpa coming in, not having known that there was an issue at all, and then stubbing their toe. This is an extremely common story. Stub their toe on a piece of furniture, on the leg of a chair, for example. They wrap it up, they take it down a few days later, it's gangrenous, it's infected, anything, so many different manifestations.